To begin our time together, I want to again say thank you for joining us and being a part of the conversation. It's a new year and a new conversation on tribal partnerships for success. With us today, we have our director for the Native Center for Behavioral Health, Dr. Anna Helena Skinstad, as well as one of our consultants, Dr. Maureen Liliskov. And I'm Allison Bays, and I serve in the Prevention Center. I come from South Texas with the Tapilam Coitecan Nation, and it's really important to know that the work that we do serves tribal communities across the country. We don't just serve one or another. We serve all the lower 48 and Alaska. So over 574 tribal communities, Native communities, and we are supported by a grant from the Substance Abuse and Mental Health Services. The content of the event today is a creation of myself and our team, and the opinions expressed do not necessarily reflect the views or policies of SAMSHA, HHS, or the American Indian Alaska Native PTTC. Although we're gathered virtually today, we feel it's important to take time to acknowledge the land and pay respect to the indigenous nations whose homelands were forcibly taken over and inhabited. Past and present, we want to honor the land itself and the people who've stewarded it throughout the generations. I'd like to invite you now just to take a few more moments to read the last few paragraphs. And this document was created by three of our former colleagues, Ella Driscoll, Keely Driscoll, Mr. Sean Bear, all of whom come from the Meskwaki settlement, which is near our university. I'd like to invite, before we go any further into the discussion, I'd like to invite my colleagues to briefly share their part in today's gathering. And remember, you have an opportunity in the chat right now to put who you are, where you come from, who you serve, and it would help us a lot if you could tell us which GPO you work with. Dr. Skinstad?
I have to remember to unmute myself. My name is Anna Helena Skinstad. I am a clinical psychologist from Norway in Europe. And I've been in this country for 32 years and worked with tribal communities since 1998. And my program officer is a program officer from overseeing activities within the Prevention TTC, and her name is Dr. Thea Walker. And if I then go to Dr. Liliskov, I have to also say that she is one of my students and have worked in the PTTC for, I don't know, was it 8 years?
Yes.
Yes.
Since 99, yes.
So why don't you introduce yourself, Dr. Liliskov?
Sounds good. My name is Maureen Liliskov, and as Ann Helena said, I was her student. And now I'm a consultant for the center. I have continued to work with tribal communities, mostly in South Dakota and the Great Plains region, since I left used to be the PTTC. So I never really left because I'm still here. And so I'm really honored to be here. Thank you.
With us on the line, you can't see their face, but we also have Cam Marsingale, who's a big part of our team because they make sure that our things like Zoom run smoothly and many other activities that we do in the communications office. So thank you for being a part of this. We do have a small group joining us, and that's good because we can have a more intimate, engaging conversation. I appreciate that. And hopefully when we post the questions and things later, you'll have the opportunity to reflect on your experiences, what is working really well for you in your area, and where we might need to help you, and communicate some things on your behalf with you. As I mentioned earlier, we serve the lower 48. We are the National American Indian Alaska Native Prevention Technology Center, and we also serve our people up in Alaska, like Chris, who's on the line with us today. So thank you for joining us. After today's event, you'll receive a follow-up of the slide deck and the recording, and we'll also have a GIPRA evaluation survey for you all, where you can help us understand how we can better serve each of you in your communities, how we can better support you with a platform like this, a conversation like this for today, so that we can continue providing support for those of you in the Partnerships for Success program. What's really important to know is that prior to my engagement with the Prevention Center, we had an opportunity to support a study that was being done across tribal lands, villages, and to understand better what the needs were for PFS grantees. And so after the study was completed, we decided as the National American Indian Alaska Native Center to invite Tribal Partnerships for Success grantees to an ongoing virtual gathering. And so we decided to focus on a few things. Obviously, we would host the platform for you to engage and support each other, also provide an opportunity for collaboration with our office in the areas that you may have a need for. And then also today, we've decided to include the opportunity to share with the National Coordinating Officer about ongoing needs for programs. We did have our NCO on the line with us prior to today's meeting, but she had an unexpected conflict right before the top of the hour. And so she had to step off, but did ask that we take some really great notes and hear your concerns, make sure that we're able to document your successes as well as your questions so that she can help at her level express those needs and garner more support for the programs that you oversee. Please know that if you're trying to write notes, you're welcome to. I'll leave the slides on as much as I need to, but you'll be getting a copy of all this after today's event. We did have 2 previous meetings in the fall, which our team was a part of, just actually engaging with you, listening to you, and trying to understand what the needs are, as well as where some areas of struggle might be. And today we're going to take it a little bit further and see what have been some of your successes. Most of us just ended our year 4. And so we know that with the roles that you have, sometimes we do come up against some struggles in the work that we do, but we also have many good things that occur in our community. So we want to hear about some of those good things as well. But previously we shared about the study that took place, and we're able to share the data, which identified factors of success, barriers in meeting program requirements, and what would be some improvement recommendations for the grantees, as well as continuing that conversation about the needs that you all have as grantees. And as I mentioned, today we're going to take it one step further for everybody to share what's going on, whether you're in California or Alaska or elsewhere. These are the 3 questions, and I will put these in the chat so that everybody can have them handy, because I'll take this off the screen in a few moments. But as I mentioned, we want to listen to what some basic challenges you have had as a grantee, what kind of support you need in serving your tribal communities and villages, and what good things are happening within your projects. I know it's really important to always think of all the things that go wrong, but I'd like you to really boast a little bit today, share about what's working really well, so that we can learn from you. we do our best to serve tribal communities across the country, but we also listen very well because we know that many of you are doing great things. And so before I post those questions in the chat, Dr. Skinstad, would you like to share any more as I'm getting that ready?
Well, one of the things that we have learned over the years, and we learned specifically during pandemic, was that the communities did not feel that they were heard. And we made it a certain point in making sure that we listened carefully. And because I remember we were sitting in our offices and really wondering how on earth are we going to support tribal communities. But now we know that there are a lot of successes, and being good models and peers for each other, I think, is crucial for us to really help you all shine. So that's why we're doing it. And I'm sort of wondering, Dr. Bays, if we, with a small group like this, should just keep it like this, or do you want to do a breakout session? Because the groups will be very teeny.
Yes, that's exactly what happened the last time we met. We were anticipating a larger group, and with a small group like this, we can keep it more intimate so that all of you can share your thoughts. I see that Tom and Angela have joined us, and so we thank you for hopping on the line. There's going to be an opportunity for us to share. I'm going to post the questions that we'd like you all to share with our group in this ongoing conversation as PFS grantees. But in addition to that, I know most of you have put in the chat who you are, but we also want to hear from Tom and Angela who you serve, what tribal community you serve specifically, and who your GPO is. That would help us understand a little bit more about the community that you're with.
And also, when we are asking you for the GPO, it is because there may be things we can help you with, but there may be things that SAMSHA needs to answer and we can't help you with. And we have developed a relationship with SAMSHA so they understand that there are a lot of questions tribal communities have when they interact with the federal agents.
So looking at the names of everybody who's participating today, I know some of you have been on previous sessions with us and some of you are new. So if you haven't been with us, or even if you have, when you begin to share a little bit about what your challenges are, because that is our first question, trying to understand better what are some specific challenges you've had as a PFS grantee. I believe I put that in the chat. Cam, let me know if I didn't do it correctly. Okay, thank you. And there's no real order to this, but I know Greg and Julia have been on the calls with us before. So if anybody, in addition to them, would like to start the conversation about what are some of your challenges?
I can begin. And I think one of the universal challenges we've all experienced has been the pandemic. And within the grant cycle with us, it occurred about maybe 15 months in. So just as we were moving from learning to lurching forward, we had to totally rethink how we did everything. And there have obviously been hiccups along the way as protective health measures are sort of reimposed or relaxed. And so this whole grant cycle, I think, has been disrupted by that, which has posed sort of unprecedented challenges. But we've persevered. We've also been a lot more creative. In some ways, I've noticed this with the center as well, extended contacts because people are more comfortable doing things remotely. But by far, the pandemic has been the largest challenge. It's also been kind of curious because I know that SAMHSA has increased their staffing during the lifespan of our grant. And so we went from a period where we had pretty strong continuity with a grants officer who was definitely overworked to a period where we were jumping almost month to month between new hires, and now have a really solid relationship with the most recent GPO, Chantel Hartman. So that was also just kind of a peculiarity, but it kind of fit the theme that nothing was as it should be and nothing was normal. And again, I missed the introductions. I work with the Santee Sioux Nation in Nebraska, and through the grace of that tribal council, work with the other tribes as well, the Winnebago, Omaha, and Ponca, as well as the indigenous populations in Metro Omaha and Lincoln and the Frontier Panhandle. So yeah, I don't want to dominate conversation, but the pandemic definitely was the largest challenge that forced us to rethink everything.
But the positive I hear, Greg, in what you're saying is it forced us all to be very creative and trying to figure out how on earth are we going to do this?
Yeah,
And
exactly.
you guys,
Yeah,
obviously. Yeah. Mhm.
exactly. And again, I think it may have in some ways even expanded our reach because people were more comfortable with this kind of communication.
Mhm.
Thank
It
you
may
for sharing.
even change everything for us. It may, when we talk about Zoom and face-to-face, which is the preferred way of doing business, but I don't know if we ever get back to that because, as you said, Greg, we go in and out of, should we travel? Should we leave tribal land? Should we do it via Zoom? And I think that's almost like going to be the story going forward because we are now being bombarded with a new COVID variant that we are not vaccinated against. So, I mean, yeah, it may be something we're going to live with.
Thank you both for sharing. And Greg, I know that everybody here, the 4 who are here from Alaska, and yourself, no matter where you're serving, we've all been impacted by the pandemic. So I thank you for reminding us of that reality because it's not over yet. Unfortunately, some people are still fighting off what has occurred in their families.
Mm-hmm.
Who'd like to share next?
If it's okay with Dr. Mashad and Tom, if I go, I feel pressure to go right after Greg because Greg and I looks like are wearing the same shirt. So it feels like I should go. So again, my name is Christopher Delgado. I'm the prevention supervisor over here at Cook Inlet Tribal Council. I still have the new car smell over here at Cook Inlet Tribal. I came on in September as a coordinator, got promoted into supervisor. And have been getting butterflies in my stomach and loving every day since I've been here. A little bit about me. I just had my birthday, so I've been doing behavioral health and healthcare operations for 20 years now, believe it or not. So I'm kind of the old crafty vet now. I worked at Daily Family Services, worked my way up from a part-time records clerk to an administrator, many jobs at Social Foundation. I was there for 11 years, helped Connect Tribal Council create mental wellness center out in the valley for behavioral health for youth. Came on here in September because CITC got a hold of me. And like I said, I got the butterflies in my stomach the first time I read the job description, and I'm just happy to be here. So I could say coming on in September, I was blown away at the organization of our program. So we do monthly Safe Talk and Assist trainings, also offering QPR trainings to youth. We have MOAs and MOUs with many community partners here, not just in Anchorage, but all the way from Seldovia up until Chickaloon. So if it's about the South Central region of Alaska. Coming on, there was some stuff. I'm all about continuous quality improvement. That's a big thing I'm about. And there's some stuff we could tighten up a little bit. And we've been working on that actively since. A big one is the we do monthly cultural activities. It's basically prevention through the lens of our Alaska Native people, basically. We do monthly activities. Last week, we went ice fishing. I know what you guys are saying, lower 48. Yeah, the Doc, you're jealous. I can see that. Yes, yes. And next month, we're doing cross-country skiing, monthly events all the time, working with ages 10 through 24. Also, we offer Safe Talk and assist trainings every month. So we did an assist train the trainer. I'm a Safe Talk trainer and assist trainer. Again, through just being very blessed to be here at Cook Inlet Tribal Council. So we do monthly trainings and monthly cultural activities. The numbers when I first came on for the cultural activities were kind of low, but at the same time, we were starting out. So not just myself is fairly new. Our prevention manager, Crystalline Lemieux, was fairly new. She came on in March. I came on in September. And we've been focusing on just tightening up and improving. So what that means is a lot of the background stuff. We were able to create our cultural activity flyers and our Safe Talk and Assist flyers. We were able to get all the this year's training dates on calendars. We were able to, we do Eventbrite. So we use Eventbrite to register for the trainings and our cultural activities. We can have them answer questions. We can have them sign consents. And again, on the background level for us, it's just about organizing. We're organizing the tubs. We're making them grab and go. So for Safe Talk, we know that we're always going to have 30 max. So at that point, we can have 30 in the tote, 30 documentation, 30 resource list, yada, yada, yada. Instead of getting ready for the month, we can just come back after the training. If there were 13 people, put 13 booklets in there instead. Grab and goes for our safety for every month, board games, and yeah, so like I said, a lot of amazing stuff. We're just organizing right now. We have an amazing presentation that we're working on, not just for our community partners to present, but for our new hires. So again, we're very lucky to have 2 new prevention coordinators starting today, or starting this month, or starting this week. And yeah, like I said, I'm just very humbled. The turnout, we're trying to work on the turnout. We're trying to find the comfortable medium with not just a turnout for cultural activities, but our Safe Talk and Assist trainings as well. Again, like I said, we work with Covenant House. We work with my house out in Wasilla. We work with Alaska Native Culture Charter School. Going through our presentation that we were working on, we had 462 trained in suicide intervention last year. We had 36 prevention trainings. We had 80 life skills trainings, 18 new partnerships within the last year, 15 outreach activities, 11 coalition meetings, and our program served 3,519 youth, basically, or served youth 3,519 times, mostly through the Alaska Native Culture Charter School this last year. So it's a good start. Don't get me wrong, but we're gonna try to. It's a good start, but we're going to try to beat that number this year, and I think we can. So I think I'm done rambling because I'm really good at chatting, guys, and I can go on and on and on. But yeah, so right now we're just trying to focus on just the back end organization. But like I said, Dr. Mashad and Tom have been amazing and very supportive of us, and I can't go on. I'm just very blessed to be at CITC, being able to ramble in front of you guys. So I'm going to hit the mute button. But if you have any questions, if you want any questions about what we do and our organization of how we do it, by all means, let me know.
Thank you for sharing, Christopher. Gosh, Dr. Mashad and Tom, I don't know if he has the right job description. Doesn't sound like he has enough to do.
Keep ourselves busy, that is for sure. And they do an amazing job. And part of the things that we talk about is just calendaring. So we calendar out for the next 3 years. And that way we know what we're doing and how we're doing it. And I talked to the staff about how when we put the effort in on the forefront, it makes it a lot easier going forward. So you're not scrambling every single time. We did have a lot of turnover in staff. And by having a system, it doesn't really matter which staff is available. Everybody can pick up the notebook, they can go through, and it could be their first day and they were able to run a program that took people out fishing. It was the first day. Because they were able to take the notebook and go, okay, this is how we do this, and this. We also do core competencies with all of our staff as well. So we went fishing, ice fishing the week before. We take students out fishing so that we go through, how do you do this? How do you do that? And kind of go through, oh, shoot, we forgot to bring garbage bags, or next time we need to remember hand warmers, and that makes it so our checklist is even better. So once everybody's been trained in that, then we don't have to do that every single time. But for the first time, we have everybody watches it being done, do it themselves, and then they're able to teach, and that's how we run our competencies. And that way, we've been able to really reach out to a lot, partnering with Alaska Native Justice Center and the Youth Employment Services, and so they all have youth in their program, but then they're able to just connect to ours and be able to just bring theirs. We have a 1-to-10 ratio is a rule that we put on just to make safety when they're doing those outside activities. So as long as they bring an adult from their programs, from the other agency programs, then they are able to bring 10 kids with them. We talk about things that are culturally relevant. They don't have to be expensive because we're able to do them culturally, traditionally for hundreds of thousands of years without having anybody giving us money. So really, it's paying for employees to be able to be those people and culture bearers. So it has been a blessing to be part of this team. And I look forward to our once a month big cultural activities, because I told my manager, my RCO, I'm like, that's the day that I'm going to go do stuff. And just so that I get regrounded and recentered on what it is and why we're doing what we're doing, because I run the recovery services program as a whole. And so there's a lot of stuff they have to deal with all the time. And so adding some of the cultural fun things into it makes it kind of less the weight. Allows you that time to shake off the bad energy from hearing the hard, really difficult stories. Which is why we also do it once a month after our assist training, because you have to kind of have a week off to shake off the suicide conversations, because it is very real in Alaska. And so somebody knows somebody who has experienced suicide. So when we have these conversations, it's not just, oh, teaching a class. This is heartfelt.
Well said. I think Angela and Chris have really well described our program and what we do. I'm newer to CITC. I joined about the same time as Chris. He's a little more senior than me on the team. But I've really enjoyed being back home in Alaska and being back in a tribal program again. I had a little hiatus for a while, working for a nonprofit and a for-profit healthcare group. But really, really proud and excited to be part of this team and doing the work that we do here in the Anchorage area.
Thank you all for sharing. Julia, this is a different capacity to which I usually see you in a different capacity, but I'd love to hear about what's going on in California.
Okay, so I put a little bit about our community in the chat. So we're a smaller tribe in Northern California, small tribal community. And so one of the big challenges this past year has been, really identifying our risk factors. We have many, and we know that we can't address all of them. So we did narrow down the risk factors that we're going to focus on. And one of the big ones is children being raised by addicts and how chaotic their households are, and lack of parental supervision in a lot of the households. And then adults that are allowing children to use both marijuana and alcohol. So those three biggies are what we're working on. We also recognize that we talk about culture as prevention, but we never really put any teeth in it because we were doing activities that didn't match our protective factors. And so we really needed to rethink that and how we were gonna, sorry, put my phone on mute, how we were going to bring those cultural things into the program and make them meaningful, useful, and have youth, participate. So in our program, we had a lot of academic kind of things going on. We're looking at all the core competencies of prevention, kind of the head, gifts of kind of the knowledge base. And then we weren't looking at gifts of the heart and the hands. And so we decided that we needed to recruit and bring a cultural specialist in because all of our job descriptions, if you looked at them beforehand, were more about, oh, you know, prevention, all the academic kind of terms that we use, but we never really were able to attract people who in the community had that cultural knowledge. So we spent some time really thinking about what that meant, and we were fortunate that one of our dance leaders, or leaders that lead our cultural activities in the community, he was one of our drivers for the health center, and so he had carpal tunnel and had you know, some time down where he wasn't working, and so we went to him and talked to him about joining our team and bringing that important component in, because people follow him, they believe in him, and it brought so much to the program that we were missing, because people weren't listening any, you know, with any real depth to kind of the trainings we were doing. You know, the kids were like, oh, gee, that sounds good, but it didn't really, you know, they didn't feel it in their heart. And so we've really spent time making that cultural component meaningful, and it has made the world of difference. And all those children, we have more than 50 kids in our community are in placement, so foster care through our ICRA. And so we pay attention to those youth that need that extra support, and we work with another youth serving program in the community called Building Horizons, and we work closely with them to really pay attention to that group of youth that are in placement and out of, you know, not with their families, with extended family perhaps, but not with their parents or grandparents. And so those are the things were kind of our challenges. We knew we weren't hitting the mark, and we just couldn't figure it out. And this has made a big difference of having that person on our staff, so we didn't have to, you know, kind of bring them in occasionally and do an event and then, you know, rethink it. And this person is part of our staff and is learning all about, you know, prevention also, and kind of connecting the dots. And it's really been a blessing to have that cultural person on staff.
And I think that's key, Julia. You summed up what everybody else was saying about their specific activities, but they're all very cultural connections to who we are and our identity. And the fact that we can identify it as culture is prevention through the activities that we've been doing for hundreds of years, whether it's ice fishing that Christopher mentioned, or being creative, as Greg said, with other projects and programs. I think it's really important that we continue to find ways to keep our young people connected to who they are, where they come from, who their family is, because that identity is very meaningful as they continue to grow and make decisions and try to push the boundaries a little bit sometimes. And they are challenged by their friends, by their peers. And when they have that culture in their life as a constant, then they will probably make better choices in life. So I want to say thank you to each of you who shared some very specific activities, very specific ways that you're helping to make meaningful projects occur in your area, whether it's up north or anywhere else across the country. I know Dr. Michaud had to jump off, but I want to invite anybody who hasn't shared a positive project, something that you want to boast a little bit about. Tell us what was successful in your community this past year. I think you all shared a little bit about some of your successes, but is there any one project that stands out?
I'll say that Quickland Tribal Council, we were able to host a assist train the trainer up here in Anchorage, Alaska. We had about 18 people show up for it, which means we have 18 more players on the bench ready to jump off and ready to help us out. And again, like Angela was saying, unfortunately, there is a need in our community here in Alaska, especially, whether it's in Anchorage, whether it's through the whole South Central region. So it felt good. Please allow me to share a little bit about myself. I actually lost my first friend who died by suicide at 13. I didn't know how to react. I didn't know how to respond. I didn't know how to express my feelings or anything. I didn't know I didn't know about the resources in the community at the time. This was again years ago. I'm aging myself. I think I have gray hair, you could see. But at the time I didn't know what sort of resources there were. So I didn't even go to my friend's funeral because I didn't know how to process it. As long as me and my team can help another 13-year-old youth here in the community not have to go through what I did, then I know I'm doing a good job, and I know my team, I know that's why we're here, and we can't lose focus on that. And just doing these trainings, doing these cultural activities, just talking with people, networking, fills my cup, because again, like Dr. Mashad said, there's unfortunately a high need here in the community, and we're have lofty goals, I'll be honest, but yeah, so again, having that assist trainer and having a whole group of us ready to go, having basically this next year's assist training trainers already taken care of, feels good. And I know that we're helping our community. So thank you.
I'll jump in there with Chris. I think that was so well said, Chris, and thank you for sharing your personal connection there with the work that your team's doing, and that we do at CITC. I think that the project that I'm going to share about isn't quite as impactful on the day-to-day lives of our participants and our tribes, but we're really proud to have just recertified with CARF. We just got our accreditation back last week, and so we're really excited. It was a tough project because our program has changed significantly since our last accreditation, and we are still fairly new in being an accredited program. So we are really proud of that. There was a lot of hard work done by our team to get there, but it was a challenge that was really satisfying to cross the finish line on.
Thank you for sharing, Tom and Christopher. You know, we're a small group today, but imagine all the other successes across Indian country and tribal villages. It's really important to know that despite the health inequities that we experience, and we know the intergenerational trauma that our communities have faced, that we're resilient. We can overcome when we have that connection to who we are and our identity and our culture. And Julia said it. I know that's something our director says often, you know, culture is prevention. And one of the things that we're doing at our center is rethinking how we continue to promote that, and tying into not just putting together, for example, a poster or a product, if you will, that can be in someone's hands, but how can we make things more engaging with our young people? You all have shared that experience that you have with the young people. It's important for us to meet them where they're at and not drag them to where we're at, to find ways to be engaging. And sometimes it's taking them away from all their electronics and taking them out and doing something outdoors. But in the winter, it can be a little challenging, we all know. So it's looking for other opportunities. And I know our team is working on that for this new year, looking for ways to continue keeping the conversation going so we can continue to be healthy communities and support you all. And I'd like to invite Dr. Liliskov, who was initial part of this PFS study, if you have anything to add before I get into our last question for our time together.
Not really, no. I think one of the things I can add is what I've seen out here, aside from COVID, what I saw in the Northern Plains tribes, at least the ones I work with, was an increase in crime. And especially with the guns. I'm not sure how you guys experience it out in Alaska and in California, but I do know we had those challenges out here in the Northern Plains.
I actually, is it okay if I chime in as well? So like I said, I'm new to Coconut Tribal Council, but I just came from South Central Foundation. I was part of the Behavioral Urgent Response Team, which is stationed in the Emergency Department of Alaska Native Medical Center, where we work with customer owners who are experiencing acute crisis events, whether it's homicidal, suicidal, posed threats themselves or other, capacity evaluations, things like that. Again, unfortunately, there seemed to be an uptick with the services and referrals being requested from attending providers for our customer. We call patients our customer owners at South Central Foundation. And I could say that there was quite a huge uptick within the last, since COVID, of the need in the community. And again, based on that need, we're able to meet our customer owners where they are, come as you are, basically. But yeah, I can also agree that there was quite an uptick in people experiencing suicidal ideation or assaults or whatever it is. So I totally can agree. And again, being at South Central Foundation for 11 years, I definitely saw an uptick. So.
Allison, I don't know if, are we still sharing successes? Okay, so, our tribe is, it's, comprised of 7 different tribes, so sometimes we refer to our community as 7 tribes, and, we don't have a roundhouse, so, it's something that we brought back into our conversation about the need to have that sacred place, you know, for our people to go and gather and to have ceremony. And we're having those conversations with other people in the community that we want to bring back the roundhouse, but there are roundhouses nearby. So on New Year's, people go to Roundhouse in Point Arena, which is on the coast, or over to Grindstone, which is over in Sacramento Valley, or Lake County, which is a neighboring county. And so this year we said, we want to bring our people together, our whole community, and we want to have prayer and ceremony for New Year's Eve, our New Year's. And we didn't have it on New Year's Eve because we know people do go to Roundhouse. So on the 28th, we had our first prayer gathering for our community. And we called all dancers, it was intertribal. So not just our tribes, but from, different areas. And we called them together, and we had a lot of dancers come. We had some other people that came, and they all sang together. We didn't have different groups. We all participated as one big group and had our first prayer circle for this valley. And so I think it's, part of us regaining our culture and our traditional prayer, place of prayer. And I think if we keep working towards it, we're going to bring back the roundhouse. We will build it. We will find the spot for it. And there's people who are dreamers. They've been dreaming it, how it will be. There, it needs to come from a couple of dreamers, a man and there's 2 elderly women that are dreamers, and so they're dreaming back our roundhouse. But it's going to take a while because we're all different tribes. We've been thinking about, talking about it, and now we're actually bringing our people together to make it happen. So hopefully maybe not by the end of this project, but by next 5 years, I would say, we're probably going to bring back our roundhouse, which will bring back our very old ceremonies and our very ancient traditional prayer ways. So that was something that I thought was really positive, that we were able to participate and help make happen.
As Tom said in the chat, what a great idea, what a great event to have for your community. I think it's important. And it's really a community event. It's not just the elderly. It's not just, one group or another. It's everybody coming together as one. You said the 7 tribes came together. And so that's magnificent for your area because, California is kind of a large spot to be in, but you were able to do that. And so kudos to you and your team and the work that you all do there in Northern California. Any other thoughts that anybody would like to share who hasn't had a chance about successes? And if you don't get a chance right now, you can always follow up with an email to our team.
I have one question for Julia. I was just passing the news channel on TV and seeing what the rain is doing to California. Are you okay? Is the tribe suffering? How are you guys doing?
It is raining really hard outside right now. And we did have a couple of power outages, but no major flooding. Our tribal emergency response staff person just came by earlier and told us where some sandbags, and our natural resources department has placed a big pile of sand for anybody who has their driveways that are overflowing. The culverts are all overwhelmed, and So yeah, we have a lot of rain, but we're really happy. We're right by the Eel River. If you look up Round Valley Indian tribes, the Eel River is a big part of our community. You know, we fish, hunt out in the area. It's the southern boundary of our reservation and the northern boundary. So the Eel River is very important to us, and it has been in drought really, really horribly for a long time. And so we're just seeing it flowing and overflowing, and flooding is like really a happy thing, but we don't want anyone to be in danger or be hurt. But of course, it is just like a blessing that we're getting this much rain.
I can see the blessing and I can see the challenges in that, but you know, it's the natural disasters are all around us, and it's very important to find a way to have a plan for what do we do. One thing that I wanted to say is that one of our PhD candidates in our department wrote a dissertation focused on what plans were implemented to take care of the elderly when they were in a situation like that, natural disaster, man-made disaster. And one of the things that we got concerned about was that very few tribal communities had a plan. So that may very well be one of our projects going forward. How can we have tried it before, and we're going to offer it again, how to develop a crisis management plan in tribal communities. I think, unfortunately, is going to be more and more necessary. So stay tuned to that. I think we will be doing that when we have talked to the person who's going to develop the training module, and then we are going to offer the opportunity to have a learning collaborative afterwards with people who are interested in developing a tribal, not action plan, because that's much bigger, but a tribal plan for what do we do if we are in a situation. One thing is a flood, you know, avalanches, fires, whatever. Yeah. So if you think, Julia, this is something that your community can benefit from, Dr. Bass and I will write, we say in Norwegian, you write it behind your ear. That means we are going to remember to connect with you when we're ready to offer this opportunity.
I think that will be helpful for a lot of tribes, and even the disease outbreaks, because
Yes.
you know that tribes were hit harder than non-native communities.
I've appreciated learning from each of you. I know that you all have such great information to share about the successes of what's going on in your area. And we want to keep these kinds of conversations going with each of you, because we know when you are able to hear from one another, learn from one another, we learn from you as well. And so it's really important to keep conversations going. Looking ahead for our ongoing meetings, we want to make sure that we are providing a platform that is needed, that is helpful to each of you. And so we want to hear from you all as well. And I'm going to send out a survey to all the PFS grantees just to get an idea for this. Would you like to have these on an ongoing basis monthly? Is that something that would benefit you all? And when we look at how do we address the needs of our individual communities, are there any specific ways that our staff, our team from the Native Center for Behavioral Health, in which we can assist you, in which we can help you continue to do your great work that you're already doing, but maybe take another path for something y'all haven't figured out how to, and we can assist in that regard? You have a few of our team members on with you today, including our director. So this would be a great time if there's something specific you'd like to engage us with or ask us about. And I am going to put our website on here. So if you want to click on that as you see it, It'll take you to our Prevention Center website. And that's the basic landing page that we've had for a very long time. And we're in the midst of updating some things, but you can at least go there and get some basic information about upcoming events, the work that we've done in the past, our newsletters regarding specific topics in research for prevention services, and a lot of other wonderful opportunities for information. And I'd like to offer that we meet again February 21st, which is a little bit more than a month from now, but it gives us an opportunity to go back to our offices, recruit some people from our region, talk about it with our teammates, and come back for the next conversation where I'm going to encourage and plan better to engage with our GPO so that we can have you share some of the things you shared with us with them as well.
And I'm very glad when I heard Greg say that your GPO now is stable, that you have someone you can go to and get answer from, because I know exactly how difficult, challenging it is when you have a burning question you need an answer for now, and you don't have anybody on the other hand. So I'm very glad to hear that.
Those of you here with us, are y'all comfortable with meeting again in February? I know it's about 5 weeks out.
And I am hoping that it stopped raining in California at that time, and that for those of us in the upper Midwest, that we don't have the terribly low temperatures and all the snow and wind that we had, and all the accidents on the road and all that. That's my hope, because in Iowa City, we had a horrible accident last Sunday because we had freezing fog. And I think some truck drivers didn't understand that even though it's just fog, it is freezing and it's very slippery. So yeah, I'm hoping we have moderate weather situations going forward.
So my goal would be to see the remaining 4 of you here, but also to see many more people out there serving, helping, providing great services to our tribal communities. We know that it can be challenging, but it also is very rewarding when we see the good things happening, when we see return to good health, when we see people connecting to culture, when we see people having healthy lives. So I want to thank you all for taking the time to be with us, taking the time to share your stories with us and those of your communities. And we always are looking forward to the success stories. Any last?
And I'm also going to ask you all another question, because now we have shared, but are there specific themes you might want us to address in collaboration with you? Please let us know.
I think it would be helpful if I like hearing about like their ice fishing, but I don't know like how they organized it and how they pulled that off. I mean, because we go out and gather acorns and do some just close by little field trips, but ice fishing, that seems like for us that would be a huge undertaking, but I think it would be awesome if we could share some of our cultural knowledge with each other too at some point in time.
I think that's a great idea. So yes, ice fishing requires quite a lot of prep.
So Julia, I love that idea. Like I said, we have everything taken care of. We have each individual month. We have an activities packet that basically goes through all the safety planning, what to do week before, everything down to charging the iPads for the post and pre and post Survey Monkey, to doing like Dr. Mashad said, the week before last week, we went out and did some ice fishing, and we were fortunate enough to get paid for it to go ice fishing. So again, we have all the back end stuff. We do Eventbrite, we do QR codes, we do Canva for our flyers. So that's something I really get involved with. I love the back end stuff of things. I love if you guys need help with policy and procedures, I'm a whiz at policy and procedures. If you need whatever you guys need, like I said, I've been doing this for 20 years, and I just, like I said, anything that we could do to make your guys' programs a little easier for you, by all means. We can send you the resources, we can send you the templates, we have it down to email scripts, phone scripts, text message scripts, anything you would ever need. Like Angela, or excuse me, like Dr. Mashad said, anyone can pick up on their first day and really start shining and really help their community. And again, I'm blessed enough to be playing my small role in it and what we're doing. But if you guys need anything like that, by all means, just reach out. If you want us to do a presentation, I'd love to do a presentation maybe one of these months, and just going through exactly what the back end entails. So everything from, like I said, from creating the event to what kind of questions you should ask during the registration process, and we're working on an annual consent instead of monthly consents for the activities we're doing. I'm a little behind on it right now. Don't tell my boss, please. I should have it done by this afternoon, but I'm behind. She asked about it this morning, so I'm trying to get it done. But like I said, we're doing on every level. And like I said, anything we can do, please let me know. I worked at Dina Yeats Suicide Prevention for a couple of years with South Central Foundation, so I'm pretty good at this and making it just grab and go is what we say. So by all means, if you guys need, please, like I said, I can send you what we have now. I can send you our activities. Can you see it? Oh, it's all blurry. But our activities for the year, our QR code at the bottom for them to register at, right with their phones, all that good stuff. So like I said, if you guys need anything, by all means, let us at CITC know, and we're more than willing to help you guys out. So, and we
And
work in an open environment.
I am hearing that you just volunteered.
Yes.
Please.
I was gonna
So
say
again,
training
you
on
are
pre-planning
hereby-
would be really cool.
Exactly. You are
Yeah.
hereby invited to make a presentation next time. But what I'd like you all to do also is to think about, given what he is saying, this is what cultural things we are doing. How does that fit into the plan? So I would love to have the rest of you come up with yours, and then see what might have been or should have been or should not have been included in all this. Does that sound like a good plan?
I think you should do a series too on I forget what we call it, but a series on how to pre-plan, because they plan 3 years ahead. And I know a lot of communities work on crisis mode and would really benefit from a series on starting small to, if you have 10, 20, because some tribes, have really small projects, but they still struggle with that because of all the issues. So if you have one project versus if you have 10 or 20 or a whole center, how do you pre-plan and make that, so that you're not operating on crisis mode all the time? Because I know that's been a challenge for a lot of tribes for many years too.
And the pandemic didn't help.
It didn't help. Well, and just, all the suicide and everything that happens.
No, I'm good. I'll be there in a minute. Sorry about
I know
that,
I
guys.
would benefit from that pre-planning training.
Yep.
Mhm.
So yeah, like I said, sorry, I got the host to unmute. Sorry, I was letting my staff. Well, one of our staff is leaving, so we're going to Moose's Tooth, the pizza place here in Anchorage. It's the #1 pizza place in the nation or whatever. So we're running behind a little bit. They're getting hangry. So they're leaving right now, but I was going to meet them up there. But yeah, like I said, any sort of pre-planning, it's all about the proper planning, guys. Like I said, I worked in enough places in behavioral health, especially, where you guys are right. It is crisis. And instead of being reactive, you can be proactive. And like I said, the proper planning, that's where I shine. So if you guys ever need help, by all means, I would love to do the presentation. I'd love to send you step by step on how to the templates we use, everything, so you guys can make it your own. And that's what we want to do. Like I said, I've been here long enough to see that we've done a lot of great things, but we have a lot more to go. And we have some lofty goals here at CITC, like I said, but nothing's unattainable. And this is just going to show it. So please, please, please let me know. I'm good at rambling. I'm good at being chatty. You can ask Tom about it. Yeah, and just let me know what you guys need. I'm just excited to be here, guys. I want to share what I know. Yeah, like I said, I'm just very blessed, very humbled to be here. And I think Julia left, but I'll email her our events flyer that I tried to show. Maybe I'll turn the blurry off, but everything's the back end work's done for this next year. And then next year after that, all we have to do is do some edits to our flyers to get their other dates done, and we can keep moving. And like I said, we're starting small. I would like to do some sort of like prevention basketball tournament or whatever the youth are into here. I know snowboarding and skateboarding is big here. I used to skateboard and snowboard myself growing up. Maybe something like that down the road. Again, to get more engagement from the youth. We're trying to figure out what promo items we should get and what the youth are into, maybe not so much the like fidget snakes that we have originally now, or youth don't want pens, let's be honest. Like, right? Us professionals during our trainings will offer our CITC pens and whatnot, but we're going back and just going through, and they ordered a bunch of chapstick right when COVID hit. So now we have thousands of chapsticks that I need to look at because I don't really trust them, guys, but that's just me. So again, whatever you guys need, just let me know. I'm just here to help. I'm just very blessed to be here. And yeah, so I hope you guys stay safe. I hope everyone's okay. It's a balmy 21 degrees outside and cloudy. So I close my eyes. I'm in Miami Beach outside, guys, just so you know.
Christopher, I think you hit on a lot of important things that came up in previous conversations, and even in the study itself, is that folks like yourself in the field who are PFS grantees, who are looking for support and assistance, also want to network with one another. They want to be able to call on each other to see what's working in their community, what's not working, what we can do different, and how can we learn from one another to support each other in this field. So I think you shared some great ideas, and I am going to be in contact with you. So be on the lookout for my email.
Don't threaten me with a good time, okay? Don't threaten me with a good time, guys. So like I said, I'm starting small here in Anchorage, and you never know if this works out. I would love to be to help anywhere I can, to be bigger, to be on your side maybe one day. Like I said, I've had 40,000 hours of on-the-job experience, and I just like to share it. So like I said, I know it works. More importantly, I know a lot that didn't work, because I was in charge of a lot of stuff that didn't work in the beginning. So yeah, so like I said, just let me know. I'm available. I can send you the presentation beforehand so you guys can go through it. Even if you guys want to use our presentation, feel free. Like I said, we have the communications team working on it right now, and we hope to do presentations at American Association of Suicidology in April. We heard something about Washington, D.C. later this year, as long as we can get the message out. And again, I know it's kind of personal, but if a 13-year-old doesn't have to go through what I went through at 13, then that's going to fill my cup, guys. So just let me know. Just let me know, please.
Well, thank you. We're at the top of the hour, actually a little over, and I want to be respectful of everybody's time. Greg, I appreciate you joining us for the monthly meetings, monthly gatherings. You've done a great job, and I invite you to keep joining us. February 21st is our next one. We're going to see which GPOs we can get to be a part of the conversation, because we know it's important that they hear from you as well and learn what your needs are, but more importantly, learn about your successes. What y'all are doing really well in your own communities. Dr. Liliskov, I want to say thank you for being a part of the conversation from the beginning and being a part of the study and helping us get this together. Cam, thank you for being on the line with us. We're going to save our chat, save our recording, and see you on the 21st, everybody. Thank you all. Have a good rest of your day.
Yeah, be safe.